Hello everyone, this is Aurelie Najm from Glasgow, reporting live from Philly for RUMNOW. I have seen quite a few exciting studies today, and there's one that I really wanted to share with you. So it's basically abstract number 402 by Ogdi et al. And they basically looked into opioids prescription in patients with ankylosing spondylitis and psoriatic arthritis, and how this was impacting the medical costs and the need for medical care in general. So first finding that I thought was quite interesting, so they looked at 800 plus patients in the Forward database for rheumatic disease, which is in the US. And the first thing that kind of shocked me was that 1 patient out of 5 was consuming opioids on a regular basis. I think first of all it's quite interesting because I think the way it relates to other countries can be a bit different. But obviously patients that were on opioid drugs were more likely to have more comorbidities, they were smoking more, they had higher disease activity, but also, and it makes sense, they had higher healthcare consumption, medical costs were higher, more visits as well. And if you look specifically into the PsA portion of the patients, 33% of visits were occurring more often annually in the context of patients, and also obviously the costs were higher for both PsA and ankylosing spondylitis patients. So this whole makes sense, but for me the question really is, does that relate to a population of patients that have more severe disease? Because more comorbidities, higher disease activity, and then obviously more pain, and because of that more opioids. Or are these patients basically prescribed opioid and therefore have more comorbidities and therefore more complications? So I think I would be quite interested to see these numbers in different countries, and I think this is obviously something that warrants further research. This was Aurelie Najm for RUMNOW. Tune in on RUMNOW for more content, and see you soon.